Hi there, this is Dr. Tammi Stewart from PT to Excel to talk about headaches and migraines. So many of us complain of headaches or migraines, and there's a big difference between a headache and a migraine that not everybody knows about. So if your head hurts, it's a headache. If your head hurts and you have disturbances in your visual field, so like seeing the auras or not being able to focus on a computer screen or not being able to read words in a book, things of that nature, that's a visual disturbance. And that becomes a migraine as far as categorically, and how we treat it is a little bit different. Also, if you feel like you're sensitive to sound, or you're sensitive to smells, or you're sensitive to tastes, or you feel nausea or vomiting, basically when your senses are disturbed, that's a migraine, not just a headache. And it can start in a variety of places. Sometimes, particularly in ocular migraines, ocular means eye related. So if it's starting like behind the eyes and you feel just like, oh, it's just like right in here, and then maybe it spreads, maybe it doesn't, and maybe you have visual disturbances and no pain, or maybe that's just where it starts. So that would be considered an ocular migraine. And sometimes it spreads to be like the whole thing. Sometimes it goes into the jaw. There's also headaches that can turn into migraines from a variety of places. So if you're a jaw clencher or a grinder, these muscles right on the side of our head, you can feel them. If you clench your jaw, they bulge. So if you're getting a lot of tension through here, and you're a clencher or a grinder, that's definitely where we would start treatment, whether it's like working inside the mouth to get things to free up and things to track properly in the TMJs, or if it's a mouth guard scenario and seeing a dentist, something like that. If it's what's called a cervicogenic migraine, so cervical spine is your neck. Cervicogenic means generating in the cervical spine. So those are those headaches that start right at the base of the skull, or even like the middle of the neck, and then they kind of work their way up this way. And they can stay just as headaches, which would be either considered a tension headache if you're like, man, everything's just so tense and it just feels like it's really tight here, or it could be a cervicogenic headache if it's like really from the joints and then going this way. Both can become migraines when you have those change in senses. So that visual disturbance, that difficulty focusing with your eyes to read things, and sensitivities to taste, smell, nausea, vomiting, sensitivities to loud noises that you normally wouldn't have. Like, these are different than, if you're somebody who's always sensitive to smells and you have a headache, it doesn't make it a migraine because you're already sensitive to smells. But this is like new onset of symptoms. So headaches are one thing, migraines another. All are treatable, whether it's through physical therapy, through massage, through chiropractic care, through medications via your doctor. Lots of different approaches. Some are even appropriate for like Botox injections. It kind of just depends. So if you're experiencing some of these things, please reach out and we can have a chat over the phone. We can talk it out in person and through an evaluation, and we can kind of weed out what type of headache you have and what we should best do about it. Because nobody should live with headaches because they're awful. And I know from experience, and it's such a better world when you don't have them. So if this sounds like you and you want to do something about it, give us a call, DM us. We're on Instagram, Facebook, YouTube, all the things. So like, subscribe, do all the things. We're happy to help. Feel free to reach out. Thanks.